Hi, and welcome to Healthy Living. My name is Cheryl McWilliams. We have as our guest today Dr. Timothy Howe, who's an internal medicine specialist at Parkview Adventist Medical Center. Welcome, Dr. Howe.
Thank you.
So we appreciate you being here again today, and we're going to talk about another intensely interesting subject, and that is blood pressure. My mom has high blood pressure. My dad has high blood pressure. My grandparents had high blood pressure. So I feel a little bit like I'm destined. Help me to understand what it is. I hear these numbers, diastolic, systolic. What are they, and how does one get high blood pressure?
Well, those are rather complex questions, but let's see if we can simplify it.
Okay.
If you take your pulse, right here at your wrist, you have a radial artery, and you can feel that if you put 3 fingers just to the outside of middle here, you'll feel your pulse. And when you feel the pulse, there's sort of a wave form to it. At the top of that pulse, at the top of the feel there, is the systolic blood pressure. That's the pressure that you get when the heart has just pumped and it's squeezed out that blood into the blood vessels. And that is the systolic blood pressure. When the pulse goes away, you can still feel the artery. You can still feel that sort of rounded feeling there. That still has some pressure in it, that artery does, and that pressure that's lower, the relaxed phase, is the diastolic blood pressure. So you have 2. The systolic is the top number, and that's that pulse, and then the diastolic is the bottom number, and that's the blood pressure when the heart is relaxed and when that pulse has gone by your fingertips.
So which is most important?
Well, they're both important. When I was in medical school, they said the diastolic is the most important, and the systolic, well, it's going to go up. In fact, the term that we used for high blood pressure was essential hypertension, or essential. Essential is something you can't do without. And it was almost as if we were saying, well, everyone gets this high blood pressure, so we call it essential. In fact, as part of aging, your blood pressure goes up. And that's what was taught. You have to have this blood pressure go up because your arteries are getting older and it's harder to perfuse the arteries to get blood around, and so, but we don't call it essential anymore because we realize it's not essential. There was a landmark study done some years ago now called the Systolic High Blood Pressure in Elderly study, SHEP for short, and we showed in that no matter how old you are, a high systolic blood pressure, that's the top one, is associated with increased risk of heart disease and increased risk of stroke.
Wow.
So systolic is very important. Diastolic is also important. What we could say is if you averaged them together and got the mean blood pressure, that's probably the most predictive. But the top and bottom numbers, that's the way we measure it in the office. That's the way you'd measure it at home if you had a blood pressure cuff. They're easy, they're conventional, they work, and they're very well correlated with disease risk.
Okay. I was once told that the top number should be 100 plus your age.
That's exactly what I was told in medical school too. I can still remember the professor. I remember his name very well. I won't tell you what his name was. He's not alive anymore, but we wouldn't want to bring disrepute on him. But he used to say a normal blood pressure is 100 plus your age. So if you were 60, a normal systolic blood pressure would be 160. That just is not so.
Okay.
Normal blood pressure for a 25-year-old is the same as normal blood pressure for a 50-year-old, is the same as normal blood pressure for an 80-year-old. We want to maintain that normal pressure throughout life.
Okay, what is a normal pressure?
That's the interesting thing, is that number has changed. Again, when I was in medical school some years ago now, they told me it was 160, 100 plus your age. And then they said, no, it's not that. It's 140 over 90 or below is normal. The JNC 7, or Joint National Convention on Hypertension, number 7, just out 2 years ago now, came out with a new definition. And that new definition of blood pressure is very important. Any blood pressure over 120 over 80 is considered high.
Wow.
Normal blood pressure is 115 over 70. Pre-hypertension, they called it, is 120 over 80 to 140 over 90, pre-hypertension.
Wow.
And then hypertension is 140 over 90 or higher. That's hypertension. But this pre-hypertension is a new category since JNC number 7, and it is a very important category.
Interesting. Is it possible to have a blood pressure that's too low?
Yes, it is possible to have a blood pressure that's too low if you have it from medication or if you're dehydrated. Otherwise, it's very rare that your blood pressure would be too low. I have people come in my office that are very healthy and their blood pressure is 90 over 60. And they say, is that too low? I say, no, that's just like a kid's. You know, cheer up. That's fine. As long as you're not lightheaded and passing out, your blood pressure, even if it's under 100 systolic, is fine. You wouldn't take it there with medication. In fact, dropping it below 120 over 80 with medication has some problems, but if it's there normally without medicine, it's absolutely fine.